Hello everybody, my name is Ryan Pfeiffer. I am a wilderness first responder. I am also a single pitch climbing instructor certified by the American Mountain Guides Association. And today we're going to demonstrate for you a patient assessment. The conditions here, it's Colorado Springs and it's about 15 degrees today. We have a storm coming in with some cloud cover. And we're going to simulate a tree climber was in my backyard here and took a fall out of the tree, and we were alerted to it when we heard the sound, and we're going to respond accordingly. Kurt, I think the guy fell. I think he fell out of the tree, man.
Oh my gosh.
Hey, does this look safe? You see any saws, anything left up high in that tree?
No.
No, nothing up there?
I don't see
Any branches about to fall?
Looks all right.
All right, man, let's make sure we're covered up. We got masks and gloves. Hey, buddy, can you hear me? Hey, can you hear me, friend? Man, I think he's unconscious. Can you please get C-spine stabilization on him?
Absolutely.
Hey, friend, are you awake? Can you hear me? Nah, man, he's unconscious. All right, I got an airway. He's breathing. Shallow. Hey, do you smell alcohol on him?
Yeah, I do.
Yeah, all right, he's got a pulse. All right, I think it's pretty obvious this guy fell out of the tree, but let's get a trauma assessment on him and see if we can't figure out what's going on. I'm gonna try to get this helmet off.
Absolutely.
All right, you go ahead and I'll keep stabilization here. If you can gently remove that helmet for me. Maybe the hood first. Beautiful. All right, I don't feel any fracturing. The skull seems stable. Pupils are still reactive to light. I don't see any broken teeth. Airway looks open. All right, I'm gonna go ahead and move down through and do a full focus assessment on him. All right, collarbones feel intact. Sternum feels good. Oh, what is that? Oh, all right, set these aside. He's got some medications on him. All right. Ribs feel good. All right, because of that fall, let's make sure we push in on this pelvis here. Pelvis feels stable.
That's good.
Arms feel stable. I don't feel or see any bleeding coming out. No, I don't see any blood. Move down into the legs here. No instability, no crepitus through the femur. Lower leg feels good. I still don't see any kind of bleeding. Don't feel any blood. Hey, we do have a wallet. Pull that out and check that here in a second. Loosen this boot up. All right, he's got distal pulses. Yep, he's got bilateral distal pulses. Let's go ahead and get an actual pulse. Why I'm doing it, can you please count his respiratory rate? Hand on the
Yes.
chest and just feel that breathing rate for me, please. All right, I've got 20 beats in 30 seconds. He's got a significantly decreased pulse rate. What's his respiratory rate?
12.
12, okay. Let's go ahead and initiate 911 right now. Yeah, please go ahead and make 911 call. All right, let's get ready to roll this guy. Oh, put a pad on the other side. And on my count,
I'm ready.
1, 2, 3. All right, hand up the back of the jacket, starting with the cervical spine. I'm not feeling any step-offs. Thoracic spine feels good. Lumbar feels intact. All right, I don't see any obvious I don't feel any obvious spinal injury for him. But with that decreased respiratory rate and that pulse, I'm thinking he might have some internal bleeding going on here. Sitting on my count. See if we can roll him back and get him in the sleeping bag on his pad. 1, 2, 3.
We have a 35-year-old male.
35. You see any medical alerts in there by any chance?
No, not on his ID.
All right, what do we have here medication-wise?
Oxycontin?
So he's got an opioid pain medication?
Opioid, yeah.
Okay. So potentially drinking, possibly taking pain medications. Decreased respiratory rate, decreased pulse, alcohol and possibly pain meds on board. 35-year-old male. He is in a sleeping bag. Keep him warm. Wait for evacuation. Continue C-spine stabilization until we get the paramedics here.
Perfect.
You stay with the patient.
Awesome. And 911 is on the way.